Now, plantar fasciitis is something that we often see in our practice, and it's something where we can combine both the Mi.TO synthesi table and the TCare very effectively. As you probably know, the plantar fascia is very connected with the posterior chain, so we can treat locally with the TCare. We can easily treat also plantar fasciitis, but why not also, while we are treating, we can strain or lengthen the posterior chain and then combine that with the treatment with the TCare. So we place our patient in a position where we are lengthening the posterior chain, and that helps us maybe treat the plantar fasciitis. So what we're going to do is we're just going to use our resistive mode. First we place our passive electrode with a little bit of contact cream under the leg. And after having done a warm-up with the capacitive mode, we would be ready to start a resistive mode treatment. So we can start easily treating our patient. And now as we're doing that, we can ask our patient to maybe do a chin tuck, and keep it keep your head on the cushion. And now we're ready to stretch the entire posterior chain, and if we want, we can add a little bit more stretch in the posterior chain. And in many cases, you will find then that your patient may notice some strain, some tension in other areas, maybe the hamstrings, the buttocks, along the spine, even up to the occiput. And that doesn't stop us to then simply take our handpiece, and we can then, for example, also treat very easily in the occiput, for example, should she feel some problems here along the occiput. So the point is that we are now stretching the entire posterior chain, and we're relieving the posterior chain of these strains and stresses in order to make our treatment of the plantar fasciitis more effective. And through that, we are working through the entire global posture system.